Welcome, everyone. This is the second consecutive today Northern Virginia Family Practice Town Hall. We're going to call these Be Well Virginia. We hope to be doing these once a week. We have been fielding a lot of questions about coronavirus individually with people on telemedicine visits and by phone and email, and we just know there are thousands of questions and we want to make ourselves as available as possible during this time of social distancing. I'm Natasha Beauvais. I'm a family physician at Northern Virginia Family Practice. I'll be your moderator this evening, and I will be introducing Dr. Cecily Havert and Dr. Ken Zweig very soon. A quick introduction to the program. The coronavirus is something that has affected all of us very, very personally, and we recognize that you will all have loved ones and family members and neighbors who will be deeply impacted by this virus as it proceeds this year. We really are hoping to keep all of our patients safe and in their homes, and we've been able to see almost everyone that we've needed to see via telemedicine. And we want to make sure that you know that all 5 of the providers here are available all day long via telemedicine, and we would really love to reach out to you that way, and for even if you have any question, just to kind of schedule a visit so we can really talk to you. It's been surprising how much we are creatively able to handle via video conference instead of in the office. So we're learning a new art of handling things with keeping you at home, but I think it's paying off because social distancing is working. During this town hall, we're pretty much going to stick to the voluminous questions you sent us via email. We had a full set of questions this afternoon, and then the emails surged, and we got a set of new and really interesting questions, which hopefully we'll be able to get to many of tonight, but we were going to do this next week, so we'll be back. The science will change next week, so there will be different answers to the questions, undoubtedly, as the science is changing every couple of days. If you have submitted questions that really involved your personal circumstances, we're going to defer those to a telemedicine visit because we really want to make sure that we answer your question individually and maintain your privacy, and also take the time that it will take to really get the full story. You'll notice that your video has been muted or your audio has been muted. That's because we are not able to take live questions right now because we just have too many people involved, so we'll stick to the questions we've received. Thank you to many of you who've been concerned about us. I'm very, very glad to report that we're all okay. Many of you have dropped off supplies, which we were in need of in the beginning. I think we are adequately supplied at the moment, but we are helping people know where to divert their supplies. So if you have supplies that you want to donate, then please communicate with us and we can come up with some suggestions that you can decide between. We do have several patients in our patient panel who have COVID and are recovering. Fortunately, none of our patients have been severely ill. And so we can tell you a little bit about how our procedures have gone and how our experience with COVID is evolving over time. I think we're ready to get started, so I'll briefly introduce first Dr. Cecily Havert. Cecily will wave again. But Dr. Havert has been a family physician in Northern Virginia for 17 years. Thankfully, she joined Northern Virginia Family Practice about a year ago after a very, very fruitful career in both Springfield and in Arlington, Virginia. To get to know Dr. Havert, you could click on a few of her podcasts, which are on our website and also can be found on her personal LinkedIn account. She has been interviewed by a local podcaster on topics like anxiety, coronavirus, menopause, and women's cardiac disease. So click on a few of those in your free time while you are going for a walk outside in the nice air. Dr. Havert loves teaching medical students at Georgetown University. She's also very active in the development of healthcare policy for family physicians and healthcare in general. She has begun recently public speaking and doing public speaking events locally on women's cardiac disease and also on the LGBTQ healthcare. She's looking for more events, so if you need something where you need a doctor to talk to you, actually all three of us are willing and interested in developing that skill ourselves, so we'd be happy to come and talk to your group. Dr. Havert loves painting and music, and a secret I learned about her recently is that she has a not so secret knowledge about the history of ghosts and vampires in southern Louisiana. She would have been in New Orleans recently, except that her travel plans were COVIDed. Dr. Ken Zweig is a regionally celebrated internal medicine physician. Hi, Ken.
Hello.
He is our most recent addition to Northern Virginia Family Practice, just joining in December. He is a passionate expert and educator about sleep disorders. So come on in and see him, and then you'll fall asleep. Dr. Zweig is also a medical blogger. He has started a blog series that can be found on our website and on his personal LinkedIn account. And we'd love to have you take a look at what he's writing about. Following in the footsteps of his NVFP predecessor, he is very skilled at dermatologic procedures as well as cardiovascular prevention. He has not figured out how to do those derm procedures via teleconference, but he's working on it. Dr. Zweig loves educating patients about how to stay healthy throughout their lives, and he really walks the walk. He practices what he preaches, and he can be found on bike paths all throughout Northern Virginia in all types of weather. I'm personally tremendously excited and grateful to be working with both of them. The three of us have a really fun energy together, and it was through that energy that we realized we could reach out to you in this format. So I will get started on questions. We're going to kind of go topic by topic, although many of your questions, your questions ran the range of about 10 different subtopics, and I'm going to start with Dr. Havert. She's going to go over testing guidelines for COVID. What are the CDC guidelines? What are we doing here at NVFP? What is available regionally for patients in this community, and who should really get tested right now? So, Dr. Havert?
Hi, thanks so much for joining us this evening. It's a true pleasure to be able to connect with all of you during this time of distancing. So I'm glad to have you here. So some of the big questions that everybody has on their mind, and a lot of the questions that came in was around testing. NVFP is doing some testing. Not a whole lot. A lot of it is limited by our resources, by our supplies. We are using Quest Diagnostics, which is a commercial lab, and they have given us a certain number of testing kits. So that's so that the resources, limits how many people we can test. And in choosing people to test, we are trying to follow the CDC guidelines of testing people who are symptomatic. Okay, we're not quite at the point where we are testing the vast population of asymptomatic people, even though we do know that there are quite a few asymptomatic carriers of COVID out there. And this is important information to have, but we just don't have the resources to be able to do this level of testing. So right now we're focusing on the individuals who are symptomatic. When we have a patient call us and says that they aren't feeling well, we'll do an intake or a triage to see if their symptoms do fall in line with what we typically consider to be COVID. We would consider testing if this individual is very sick, if they are close to needing hospitalization, if they are high risk, whether it's a medical condition, their age, basically anything that would predispose them to having a more complicated COVID course, theoretically. So these are the people that we want to get tested right away. And these are some of the people that we have tested here in our office.
Could you comment on testing centers?
Yeah, I was going to do that next. So unfortunately now we don't have the testing kits are dwindling, so we have to look elsewhere at this point. So there are some testing centers here in the Northern Virginia area. Virginia Hospital Center has been active for a while. That's a drive-through facility. However, you do need a doctor's order for that. There are, Inova has opened some respiratory urgent care clinics, and they're located in Tyson, Chantilly, and North Arlington. You can go to those clinics without an appointment. You will need to register from your car, but you can go there to be evaluated. Alternatively, if we evaluate you via telemedicine and we deem that this is an appropriate person to be tested, we could send you there with an order to be tested as well. So that's some of the local testing that's going on. As far as there's rapid testing too. I think that's sort of the new testing hot thing that's coming down. Personally, NVFP does not have any rapid testing at this point. Some of the hospitals, I know the Inova hospitals, as well as Virginia Hospital Centers, do have the rapid testing in their emergency departments. If there is somebody who is ill, very ill, and needs to be hospitalized, and we need to know whether or not they have COVID immediately in order to determine what type of treatment we do in the hospital, that's where the rapid testing is coming. Eventually, maybe we'll get the rapid testing, but right now it's we're not there in our community.
Cecily, two questions that are, I think, important to address are, one, the accuracy of the tests, and why don't we comment on that first?
So unfortunately, I mean, a lot of these tests were developed very, very quickly for obvious reasons. But unfortunately, when you develop a test really quickly, it doesn't always work perfectly. And so we're finding that the testing that we've done there is more false negatives, meaning you could have the condition and have a negative result. So we are seeing some of that. Some of the limitations we also found with our testing is that it took a really long time. We were having, sometimes between 7 to 10 days between finding out, having your symptoms develop, testing, and actually getting a result. We'd get a result, and whether or not you were positive, you could be feeling great at that point and passed everything. So that's one of the limitations that I think the rapid testing will, help out a little bit, but we need that rapid testing to also be accurate. So.
And another important aspect of that if you could comment on from my perspective is, what does a positive mean and what does a negative mean? Does a negative mean you're in the clear?
A negative does not mean you're in the clear. It could mean that at that very moment you're in the clear. However, you could potentially still have COVID and you just haven't converted to a positive until 3 days later. So it's the testing is a little limited at this point.
Mm-hmm. So a positive test is helpful, but a negative test is not reliable indefinitely.
Exactly. That's a good way to state it.
Dr. Zweig, I'm going to move to you, and we're going to ask some questions about antibody testing. So once a person has had COVID and they are hopefully developing antibodies, when are we able to test for that? When is that going to be fully available? And what does that mean?
Right. So for those of you who may not know, we all hear about antibodies. They're a hallmark of our immune system. And so when antibodies are basically like, one way of thinking about it is like tagging animals in the wild. The antibodies themselves don't necessarily do the work, but they tag foreign bodies. If you were to tag an animal that is supposed to be taken away eventually, the antibodies tag foreign bodies in our body, like bacteria or viruses, that our immune system can then notice that they're abnormal and then can go on to take care of these and kill those off. And so antibodies are a really good a really important part of our immune system, and a really good marker that we can use to say, hey, we've developed some level of immunity for certain diseases. It's not always reliable, though. There are times where you don't have detectable antibodies but still could be immune against something, and there are times where you can have detectable antibodies but are not immune. One example of that is HIV. Is a condition where people do develop antibodies, and that's what we use to detect whether they have HIV or not. But unfortunately, in the case of HIV, it doesn't actually treat the condition. It doesn't actually help you fight it off with your immune system. So there's a lot of hope that antibodies in this case will work. And there's some suggestion that it may. I think we'll get into that a little bit later about people who've gotten over COVID. But right now, we're still in the very early stages as far as checking antibodies, testing for them, and determining whether that is helpful. We don't know how good these antibody tests are, and we don't know if you do have antibodies, if that means that you are going to get better or immune or not going to get this condition again. And the virus, even if it does mean you're going to get better, the virus may mutate to something where your antibodies don't work against it. So there's a lot of unknowns, as with a lot of things about this. This is still a very new disease, and we're still just learning a lot about this. The science has moved forward on this faster than probably any disease in the history of the world. The gains that we've made in just 5 months are absolutely staggering. So the hope is that we're going to learn a lot more and really make some good headways in just even the next few months, which is an absolutely incredible effort. But right now, testing certainly is not available to the public for antibodies. It is available in some in-hospital settings for research protocols, but I think we're a ways away from testing and using that testing to determine whether you're safe.
Yeah, a lot of our patients have been asking this question, and as soon as we know more about what's available, we'll let you know, but it isn't currently available. And as Dr. Zweig said, we don't exactly know what it would mean if it were. I think Dr. Havert, you're going to talk about blood and plasma donation, kind of an offshoot of the antibody question.
Yeah. Well, there were a couple of questions that came in asking about, can I donate blood? What if, can I donate blood? What if I've had COVID? Can I donate blood? And can that be helpful for people who are fighting off the disease currently? And one thing I'll say is for blood donation, there's, when you're donating blood, there's actually 3 components to the blood that you are giving. There's the red blood cells themselves, okay? And this is what, when you're anemic and you need to have a blood transfusion, this is what is going to potentially save your life. So there's the red blood cells, there's platelets, which is another component of the serum that the blood products that you're getting. And then there's the plasma. Now, when we're talking about COVID, we're really interested in the plasma because that's where the antibodies live. And that's where, in theory, we potentially could take somebody who has been exposed, who has fought off COVID, take their antibodies and potentially use them in treatment for somebody who's currently fighting that, fighting off. Now, right now, it is not, you can't just go to the Red Cross and say, I'm going to donate my blood. I don't know if I've had COVID, but maybe it'll help. Right now, there are research studies going on. In fact, there is one at Inova, and we can probably pass on some information about that for people who have known COVID after this, who have known COVID, who have tested positive for COVID, can donate their blood products, and they'll be using the plasma potentially in some research studies happening there.
Mm-hmm. Yeah, very active research going on right now, probably as we speak. So anyone that needs to know that link, we can provide that to you after this.
I will say also that just giving blood itself is really important, whether you've had COVID or not. There's a lot of people in the hospitals. So if you can donate blood, you're healthy enough to donate blood, it's always something to consider doing.
So we're going to talk a little bit about the disease itself. We're going to actually start with the more serious kind that people are really worried about. And then we will discuss the more mild kind that can still be somewhat really tough to get through, and we can help you understand how to get through that at home. One caveat to these questions is that when we're talking about the seriously ill patients, none of us are ICU doctors. So some of you asked some very specific questions that really relate to very active decision-making changes that are being made within the ICU. And although we are aware of those, we're not really capable of commenting on the whys. So I think we're going to skip some of those more specific ICU ventilator questions and answer some more general questions about what is getting done in the hospital. Dr. Zweig, if you could start to talk about, I think many questions came in about feeling surprised that this was a virus that seemed to be affecting other organs besides the lungs, since we all came into this hearing from the CDC, if you have a cough and a fever, worry about coronavirus. I think those of us who've been in medicine for a few decades have seen many viruses that affect many, many parts of the body. And so from the provider doctor perspective, it's not surprising that people are experiencing kidney disease and cardiac disease and liver disease that are related to viruses, because that is something we see in a lot of viruses. So Dr. Zweig, if you could talk a little bit about the cytokine storm that throws people into the most severe form of this illness, and then some discussion about some of the experimental treatments that, of course, none of these treatments are well vetted since we've only been 5 months into this.
So yeah, first of all, I will say I'm very impressed with our patients. These are some incredibly intelligent and advanced questions. So cytokine storm, ventilation strategies, I mean, that's incredibly specific. So we're working with some very intelligent people here. So kudos to you for staying up so on top of this. But so just to put it into another context, one thing that I always tell the patients on a more mild standpoint is that, if you have one way to tell if you have a bacterial infection is if you have like sinusitis, you have pain right here, or you might have an earache. When you have a virus, it's much easier to tell when it's a virus because it's everywhere. Your ears hurt, your nose runs, you have a sore throat, you have a cough, and it's sort of all over your body. And so that's one way to think about this on a more severe scale. Coronavirus goes to your whole body. It infects many, many different organs. And why it infects different parts, we don't really know, but it's very common for it to impact the kidneys. It's actually common to have GI symptoms, diarrhea, and other parts of your body affecting the kidneys. When you get such severe infection, the other thing is that it may not even be the virus that's causing this. It may be your own body that's doing it, your own immune system. And its efforts to fight off the virus becomes so overrun, the immune system can actually start causing its own damage. And that was sometimes what makes people so sick. That's what that cytokine storm is. Cytokines are part of your immune system. And if you have a very big infection or a very big immune response to that infection, that can be what makes you so sick. Partly, fever is really not the infection. Fever is your response to the infection. Feeling bad is not the infection. It's your response to the infection. It's your immune system working on that. And sometimes the immune system can over-respond and cause its own form of damage. And when it gets completely out of control, that's what's called a cytokine storm. We have an over-revved immune system response to a very big infection. And that can cause its own real problems. That's what sepsis, if you've heard of that, is one form of that. Blood pressure drops. You can get infection in the heart and the kidneys and all these what's called multi-organ failure. And that's really getting towards the end stage. Those are the people that are in the ICU. Also, the problem with it is it's a very hard thing to stop. We don't know how to do it, even in any real infections, all that well. All we can do is support the person until it sort of runs its course and then hopefully let them get better on their own. There are some efforts that are currently underway to help with that. There's some antibodies against something called interleukin-6 that look like they might have some benefit in this. Those studies are currently going on at both Virginia Hospital Center and Inova Fairfax. As Dr. Havard discussed, something called convalescent serum or convalescent plasma. It's the plasma of people who have gotten better, who now have antibodies to COVID. If you donate that, when you give that to people who are in the ICU, there's some small studies that have shown some benefit. One of the more encouraging ones is something called remdesivir, which is an antiviral that was developed for Ebola a couple of years ago and was sort of put on the back burner. And now they're bringing it back out again because it looks like it has some benefits. And there was, again, one relatively small study, but bigger than some of the other ones, that showed some pretty impressive responses. So far, from what I've read, that looks to be the most promising from what I've read. But all of it's still very early. We still really don't know. These studies are ongoing. Typically, under other circumstances, it takes years for these studies and drugs to get to market. We're only 5 months in, and we're pushing these through and already seeing some positives from that. So it's moving at an incredible pace. And hopefully we'll have some better answers in not too long time. But the nice thing is, in this area, we're in an amazing area for medicine, for inpatient, between Virginia Hospital Center and Inova and all the hospitals, all the universities downtown. We have incredible resources here, and all of these things are all being studied at both Virginia Hospital Center, Inova Fairfax, and at some of the other centers around town. So we have access to some of the most advanced medicine in the world, really, right now, which is encouraging and exciting. Hopefully one of these studies will come through and give us something that we can really hang our hat on. But that's like a lot with this virus. It remains to be seen for sure. So stay tuned.
I'm going to take this next question because I've worked at NVFP for 12 years, and these other two are a little bit newer. So the way we do things is a little more familiar to me. The question is about, how does NVFP stay involved in your care when you're hospitalized? And there's two answers to that. Under normal circumstances, we would be in touch with your attending physician, depending on which hospital you're admitted to. Sometimes we would be working directly with physicians that we work with all the time at Alexandria Hospital, because we're very close by there. We have a husband and wife team that does our inpatient work all the time, and we're texting them every day and talking to them back and forth. If you had been in the hospital for a long time, often we would have come in to also oversee your care. We wouldn't be entering the orders there, but we would be talking with the specialists, talking with the internist who is taking care of you. We would be regularly involved. If you have COVID, and actually, even if you don't have COVID, but if you're in the hospital for any reason right now, no one who is not directly involved in your care is allowed to participate and visit you. So it's a pretty lonely time in the hospital. I think the ways that we would be helping now would be somewhat similar to the ways that we always did, is that we would be in touch with the specialists and the doctors who are working on your care and communicating to your families and making sure that something about your history that we knew that they didn't know that would be relevant was something that wouldn't be missed. I think a lot of times it just really helps have somebody who's paying attention to the whole picture. Sometimes the hospitalists change from one week to another, but if we can be that kind of steady, constant source of awareness on what's going on with you, then we can be very, very helpful in your inpatient care, even though we're not the people that are directly administering the care. We are proudly not affiliated with any hospital, which means that we can help you in every hospital. So we really can reach out to wherever you are. And if you are admitted to the hospital in Baltimore, we can reach out to the hospital in Baltimore and find those attendings and work with them. And if you are at Virginia Hospital Center, we will find those attendings and work with them. So some places we know people better and some places we don't, but we work with everyone. People who've been at Sibley Hospital, Alexandria Hospital, Johns Hopkins, Virginia Hospital Center, all of those places. So that's a long answer to how we would help you, even in a time where we're no longer allowed to come and visit you in the hospital. We're going to move on to Dr. Havert and talk a little bit more about the care of the more mild to moderately ill people who may be suffering with COVID and handling it at home. So what does this look like? How do we kind of stay in contact with you while we're sick? What can we do to take care of ourselves at home? And what do we do when we are caring for someone who has COVID in our home when we don't have it?
Well, thankfully, about 81% we're thinking around 85% of cases of people who do get symptomatic from the COVID infection are mild. Thankfully, I mean, this is one silver lining that we have about this this virus. I mean, it can cause people to get very ill, but most people actually don't get that sick with it. And and we've alluded to the people who don't get sick at all, and that's it's nice not to get sick, but it's a little bit scary to think that you could be passing this on. And I think we'll be talking about that a little bit more with social distancing and why it's so important to do that. But if you do get mildly sick, what does this look like with COVID? Unfortunately, it could look like almost anything. I mean, fever is probably one of the most common symptoms that you've got. A cough, runny nose, and GI symptoms are something that we've been seeing a little bit more often. A little bit of abdominal distress, diarrhea, generally just feeling bad. I mean, just what Dr. Zweig was saying, just how the virus just sort of takes kind of over your entire body. You just feel bad. You feel achy, and you just don't feel right, very fatigued. And as long as the symptoms that we worry about, where we think that you would need higher levels of care, would be the respiratory symptoms. It would be the shortness of breath, feeling like you can't catch your breath, or just extreme weakness where you can't, you're fainting, or you just can't stay upright. So those would be reasons to seek higher levels of care. And when you do get sick, we recommend that you call in. We'll do most likely a telemedicine visit and just determine sort of where you are in that spectrum. If you are really sick, I mean, we can make the determination at that point to send you to the hospital. If it seems critical, then you go to the hospital and we let the ER know you're coming. If you are otherwise stable and just feeling a little sick, like I was saying, we potentially could bring in some people to test, although right now the CDC is actually recommending not testing people who don't need to go to the hospital. They're recommending that people stay at home with their illness, because you also have to think about when you do come out and we test you, you're exposing the healthcare workers as well. And, we're happy to, be there for you and test you if need be, but if it's not anything that's going to necessarily change your care, there's there's potential exposure, and working on the front lines, we don't want to get sick ourselves. We need to maintain the front lines to take care of everyone else. So, but anyway, so we would, determine that you stay at home. I like to check in regularly on patients. We invite you to, either email or call with daily updates. We can check in with you, but that's pretty much how we're managing COVID at home, or what we think it could potentially be COVID at home. So let's see. Oh, and then if you're caring for somebody, so what if you're healthy, but you've got a child, or maybe you've got an elderly parent who has COVID? It's important to isolate that person in their own room. Try to, if when you're taking care of them, if they can wear a mask, and you can wear a mask when you're in the room, that would be ideal. Either using gloves or just frequent hand washing, making sure that you don't share silverware or anything like that. If the bathroom, I think, you having that sick person use that bathroom only, or if you do have to use that bathroom, you're going to have to clean it extensively. So that's something to keep in mind. But most people do recover from this, and it might take a week, it might take a little bit more than that, but eventually, just like a bad cold, you do get over, you get on the other side of it.
Yeah, and it could be quite serious, like a bad flu, and still often is manageable at home. Someone wrote in from home, well, why treat it if it's kind of the same treatment as the flu? Why figure it out at all? And I think the ICU management is quite different for people who have COVID versus who have the flu. And the trajectory of what happens to people in the ICU is very different. So I think it's really helpful as we're learning how to handle the virus and how to anticipate and how to better prevent some of the consequences, the systemic consequences of the virus. They are turning out to look different than the flu, at least in those very, very ill patients. So maybe we'll learn about how they're different in the moderately ill patients as well as this goes further along.
If you don't mind, if I could just say one other thing about testing, because I've had actually several patients ask me, just to get testing just because, or they have very mild symptoms that don't even sound like COVID, but maybe, but probably not. And the other thing we don't want is not only expose us, but also not to expose you. You know, if the point, if you have mild symptoms, even if it is COVID, more likely it's something else, but to have you come in or go to a testing center where you could potentially get exposed to find out if you have this disease and then put you at risk for getting the disease is not the right thing for you. So, you know, for everybody involved in milder cases, you know, so many people want to have testing because they just want to know, but just knowing is not always the right thing. It's not always the safest or right course of action.
Not at this point.
Yeah.
Not at this point.
Yeah, there are those countries who have done almost universal testing, and of course, they have a much different profile of prevention. And if we could get to that stage, that would be wonderful. So maybe in 2 months we'll be there, right? But not as of today.
Right.
Next week we'll have another one of these, and maybe we'll have a different answer for you. Yeah.
Right.
Dr. Havert, just finishing on the more mild cases, what about hydroxychloroquine, Plaquenil?
So this is another big topic. The hydroxychloroquine is a medication that I think that there's been a couple studies that they've looked at this. I think there was one study that didn't show much benefit, maybe another that maybe showed a little bit. But right now, it is not a medication that we routinely would recommend in using, especially in the mildly ill COVID cases. This is a medication that is typically used for people with autoimmune conditions. There can be side effects associated. Sometimes the side effects are worse than what you're potentially treating. Again, this is a medication where they're still doing research. Maybe there will be some information down the line about its benefits, but I think right now the risks outweigh the benefits, especially using it in the mildly ill.
And how long do we quarantine after we've been sick?
So this is what we're typically recommending is that from the time that the symptoms develop, you want to be at least 7 days from that. But you also want to be fever-free for at least 72 hours. So that's that, and that's what the CDC is recommending. There might be some evidence to show that you're shedding the virus after that point as well. So I think the longer that you can stay quarantined or isolated or away, especially from people who are higher risk, the better.
Mm-hmm. Dr. Zweig, do you want to add to that?
No, I agree with what she said. I think that it's, the longer you can wait, we just, I feel like we keep saying this, we just don't know. We're still waiting for more information. And part of the reason why we don't know is because I think it's very variable. I think some people after probably 7 days is probably fine. Some people 14 days may or may not be enough, and may even be longer that they're shedding. And we don't know if that shedding is enough shedding that you can still transmit the virus. So we're still waiting to get some more information about that. But it's everything about that we're doing is all about just trying to mitigate risk. There's no way that we're going to make the risk to zero, and probably unlikely the risk is to be 100%. Anything that you can do, the farther away from somebody, the more precautions you take, the longer you wait, the less the risk is going to be. And so that's the thing that with all of this is just, what is your risk tolerance? What is your overall risk as far as health? Are you older with other problems? And weigh those all into what actions you're willing to take. So the more we do, the less likely it is that any of us will get this disease, and the less of us that get it, the less likely it is to spread. So we try to do the best we can.
And when you actually have that question, I think we should just all have a specific discussion about it, because next week the information we'll have a little bit more information, and the following week a little bit more. So it depends on where you are in your illness and where we are in the scientific understanding.
Right.
There are many questions about prevention, which is my favorite topic, since I'm a preventive medicine physician. I really would have preferred it if none of our patients had gotten COVID, but we would like to prevent all of the rest of you from getting it. So we have questions about new recommendations on social distancing and lots of questions about masks and gloves. So Dr. Zweig, I'll have you take over about social distancing recommendations and your thoughts about masks and gloves in public places.
So obviously, you're all aware of this, which is why we're using this format to have this this town hall meeting, because we're all doing the social distancing. And the first thing I'll say is that it looks like it's working. You know, so far we're doing pretty well. I mean, we had a big surge of cases in the U.S. and we've had a lot of cases in the U.S. But at least in Northern Virginia, we seem to be doing very well. Relatively well compared to a lot of other places like New York and Detroit. And at least overall in the US, we think that the curve is flattening and that we're reaching a plateau and hopefully we'll be coming down the other side. So the efforts that everybody is doing, and that counts for each of you because this is not something that just the government does. We all are in this together and we all have to do our part. And it seems to be working to a definite degree. So we have to just keep this up until we can get to the other side of this. And the things that we can do, obviously we're already doing, just to give you a little more details on this, obviously the social distancing is the one that we're all doing. The things that you read in the paper and everywhere, the recommendations are 6 feet. You know, the reason that 6 feet exists is because that's the distance that respiratory particles and droplets, when you breathe or cough or sneeze, tend to be expelled from our mouths. And so this disease is, we think, is mostly spread through airborne respiratory droplets. So if you're more than that 6 feet away, then the risk of you getting that disease is much less likely. Obviously, 6 feet is better than 3 feet. 8 feet is better than 6 feet. The farther you are, the less likely you are to get it. Staying at home away from anybody else is the least likely for you to get it. So the more you can stay away from people, the better. And that's where the social distancing comes in. You know, there's a lot that we still don't know about that, how far it spreads. Indoors seems to be higher risk than outdoors because outdoors wind and currents can take the droplets away and make it less risky. But there's no distance that's absolutely 100% safe. The farther you are, the better. The more precautions you take, the better.
Can you give us mask recommendations outside and inside?
So there's also a developing thing. So masks, you know, what the masks do, for the most part, masks protect other people. And so rather than protecting yourself, when a surgeon wears a surgical mask, he is not trying to protect himself from what's inside the patient. He's trying to protect the patient from what's inside of him. And so the mask prevents things from going out. It doesn't do as well for things coming in. But if everybody or most people are wearing a mask, even if they have COVID, if everybody's wearing a mask, we are preventing the spread from one person to another, even if you don't know you have it. Right? The way you can think about this is like a hose. If you have a hose and it's shooting water 10 feet and you're 10 feet away, you're going to get wet. If you put mesh over the hose nozzle, it's going to slow down that hose. It's going to decrease the amount of water that's coming out to maybe 6 inches. And so the water's still going to get out. But if you're 6, 8 feet away, you're not going to get wet. You're only going to get wet if you're right up very close to it. And that's the way the masks work, is they slow down the ejection of the virus particles. So really, it takes everybody to wear that mask for it to work. That's the surgical masks, bandanas, dish towels, whatever you want to make, you know, whatever you want to use, any form of cloth or anything that slows your breath down from going out can work. And these homemade masks are fine with that, but everybody has to wear it. The difference is that there's something called an N95 mask, which is a medical mask that we are reserving for the medical community, the hospital workers and people at high risk. Yeah, thank you, Cecily. So she's going to show you what these are. They come in different ways.
To still be in the office.
Yeah, right. So that is one version of an N95. That one is protective, even if nobody else is wearing a mask. 95 means it prevents 95% of the virus particles. That's the surgical mask that she's wearing there. Thank you. Thank you, Vanna. But the N95s we want to reserve for medical workers in the hospital or the high risk areas. So the other masks of any kind, they work as long as everybody wears them. So we encourage you, anytime you're out in the community, around other people, shopping, at the pharmacy, even if you're going exercising on a crowded path, it's probably a good idea to wear a mask to protect everybody. And the more that we do it, the better we'll all be.
And how about gloves?
So gloves can help if you're going, especially for shopping. If you're going shopping, food shopping, or maybe to the pharmacy, the virus is not spread through your hands. So by wearing gloves, you're not protecting your hands. You're not protecting yourself necessarily directly from getting the virus. But wearing gloves, what it can do is you can spread the virus by touching something that has the virus droplets on it, and then touching your face, your mouth, your nose, your eyes. And so we do recommend to keep your hands away from your face. When you're wearing gloves, one, you are more likely to be aware of your hands and less likely to touch your face while you're wearing gloves. Plus, if you get virus particles on your gloves, they're easy to take off. And then you can either, if they're disposable, throw them away. What I would recommend more is have like dish gloves or any kind of gloves that keep you from touching your face that you can then wash either under, soap and warm water or with Purell or, a soap wipe, whatever you can use. But anything you can use that's an extra layer of defense that helps. The gloves really help, keep you from touching your face, but they don't prevent you from getting the virus on you.
I love the question we had earlier today, which was about a person who had taken her reusable dish gloves to the grocery store and went shopping with them, came back to her car and put them in a bag, and was wondering if that was the right protocol. Something that is really not well understood among non-medical people is that you still have to wash your hands when you take the gloves off. So Dr. Zweig, what are the best practices when you come out of the grocery store with your arms full of groceries and you're about to get in your car?
So, you've got to figure, we all have to assume that we have the virus on us. When you're going to the grocery store, anywhere in public, people pick up an apple and they look to see if it's got bruises and then they put it back. And then, we all do these things. So you want to be careful about when you touch all these things, you could potentially have the virus on your hands. So one thing is you want to make sure that you're decisive when you're at the grocery store. Don't pick up a number of different things, look at them and then put them back. You want to just grab something and just take it and move on. You want to limit how many things you touch. And then once you're done, once you come out, you have to assume that that's on your hands. So anything you touch with those hands or those gloves is then going to have the virus particle on that. So if you're wearing gloves, before you touch the car, before you touch anything else, you want to take those gloves off. And if you have a wipe or Purell or something, then you want to also wash your hands and put the gloves in somewhere safe. Again, either throw them away or preferably a reusable gloves, because we want to, again, save medical equipment for the people in the hospital. But you want to put the gloves away in a baggie or somewhere that you can wash them later with soap and water. And then if you're, again, the matter of how much effort you're willing to put in, even if you wash your hands, it's still reasonable to wipe down the car, the door handle, the steering wheel, and other things that you touch, because, it's possible that the virus is there. So, you want to be cautious. The more precautions you take, the less likely you are to get this.
You mentioned soap and water.
I was going to say, the good thing is that the virus is kind of wimpy and that it just dissolves to regular old soap and water. You don't need disinfectant. You don't need something fancy. Regular old soap and water washes it away and kills the virus. That's a good thing.
Mm-hmm. And Dr. Haver, I thought you did a great job earlier today just explaining that even though it sounds basic, hand washing works.
It really is. And I want people to think about that, because hand washing, that is your big, we all get upset or we're frustrated because we feel like there's no treatment for this. There's nothing we can do about this. But actually there are. And we're doing it by socially distancing and by not allowing the virus to get to us. The virus doesn't want that. The virus likes people all be close together and spread around. We're almost like a vaccine. Almost like saying, no, sorry, you can't get there. But hand washing is something that you have complete control over. And, so you can wipe down your countertops, you can wipe down your car, you can wipe down your groceries and everything. And that's fine if that makes you feel better. And, it's good to sort of maybe limit if there is virus on there, but just wash your hands. All you need to do is, if you touch those things, don't panic, wash your hands. And you've got the virus.
Right. Hand washing is ours.
Taking care of it. You don't get the virus.
Okay, so hand washing, hand washing, hand washing. We're all doing a lot of that, and some hand lotion on the side to keep your skin intact. Let's see, we're going to move from prevention, masks and gloves, to kind of how do we interact with others. So there's a lot of questions. Dr. Havard, I think I'll move to you for bringing people into your home, really emotionally poignant questions about, can our grandparents see any of our grandchildren anymore? That's on the kind of more precious side, to also, can I let the HVAC guy into my house to fix my air conditioner? Can I get a haircut? Can I let my friend who stays 6 feet away from me on the porch into my house to use my bathroom? Dr. Havard, I'll turn it over to you.
So again, I mean, we have different gradients of risk that we're willing to take, right? And I think a lot of that depends on if we are chronically ill, if we are at risk for, if we were to get this virus, how severe potentially it could be. So I think we have to keep that in mind when we're making decisions about bringing anybody into our home, because potentially, even if they are 6 feet away from us, you know, they potentially could still be bringing that in on their shoes, you know, if they touch something inadvertent. So, I mean, so, you know, the simple answer, or the short answer, is no, you know, you shouldn't be bringing people into your house. But probably the more nuanced, or the longer answer is, well, you know, if you absolutely have to, take the necessary precautions in order to protect yourself and them, quite frankly. You know, if it's a service repair, if it's something you can wait for, try to reschedule it. If it's something you absolutely need, if it's, you know, like I think Dr. Zweig's refrigerator broke, and you know, food's going to get rotten. So you do have to bring these people in. And so making sure that, you know, when you're around these people, you're wearing masks, you know, asking them to wear shoe covers, or just making sure that, you know, everything that they touched is something that you've cleaned. Bringing people in to cut, I mean, you know, obviously we can't go to the barbershop. Bringing people in to cut our hair, again, I mean, that's pretty close contact. Bringing somebody that close in, I mean, I get it. We're all going to look pretty shaggy. My roots are coming in, you know, it's not going to be, but I mean, that's some pretty close contact that you're having with somebody who's doing your hair and cutting your hair. So that's something I would be really, really careful with. House cleaners, again, I mean, that's, again, it, you know, if they're cleaning, so in essence, you know, they're eradicating the virus that they have, but, you know, just being very careful wearing masks, asking them to do that. And again, it's just something you have to decide if you're going to take that risk. Play dates for kids, I mean, I would, you know, especially bringing kids into your home, absolutely not. I mean, that's, you know, as we all know, kids are wonderful, but they also like to carry germs, and, you know, they don't necessarily wash their hands as well. So that's something you know, unfortunately, we have to say no to. You know, sometimes, you know, meeting a neighbor coming by 6 feet away, saying hi, you know, having a Coke or something on the front lawn. I mean, that's probably okay, as long as you know, you're far away, but don't invite them. If they need to use the restroom, don't invite them in to use your restroom or anything. I mean, it's just be smart about that.
And the grandparents and the grandchildren, one of the questions was, could we ever foresee a way that we could ever have our grandchildren around us in the near future?
That's a hard one. I mean, it's just, again, kids and usually 65 and over. I mean, those are two really challenging demographics. And when you put the two together, you've got potentially, you know, a bad outcome. I don't personally want to be the one to say, no, you can't see your grandchildren, because that just sounds cruel. But I think just what we also have to remember is that this is hard, and I totally validate that, but this is temporary. Okay. This is not going to be forever. We will get out on the other side of this. I don't know what things are going to look like on the other side, but it won't always be this way. But the more serious we are about distancing, the quicker we're going to get out of it. So I'll leave it there.
Well said. Dr. Zweig, I heard you went to a restaurant and got some takeout the other night. We have lots of questions about how do we safely interact with food preparers, restaurants, what are best practices for takeout? Do we need to disinfect our food? One patient asked if she should be washing her lettuce in Clorox. I'd like to answer that too, even though it's not a takeout question. And yeah, so could you just talk about best practices with takeout food?
I will talk about my practice. You know, I haven't read anything about best practices specifically, though I do know I've read a lot about how the virus transmits, and so you know a lot of the local restaurants are still trying to stay open. You obviously can't go to eat in, but they are letting you do takeout or delivery or Uber Eats, things like that. And I think it's really good to help support your local community as best you can. And that's one of the things we want to do. We want our favorite restaurants to still be there when we're on the other side of this. So we're trying to support them as we can. And so some of the things that you can do, this, again, like I said before, this virus is kind of wimpy. You know, it dissolves with soap. It also it dies pretty easily with heat. And so one thing you probably want to do is make sure that whatever you get, if you order something, that you order it hot. Right? It doesn't seem like this virus lives very well at all on food in general. So even cold food probably is safe, but we know that hot food is safe. So if you get something hot, you're certainly going to be in good shape. The problem comes in the container and the people who are giving it to you. So one of the things that we did is when we've gotten food is we just pull up and we open the trunk, and then they just put it in the trunk rather than actually interacting with you as much as possible. And then just paid for it over the phone if possible. If you have to hand them a credit card, just be careful about that. You know, whatever you can do to limit your interactions with the server is always worthwhile. And then when you get home, rather than putting the bag and the container on your counter, put it on the floor and transfer the food to your own plates and your own containers that you know are clean and not have anything on them. Again, the more of these things that you do, the less likely you are to get infected. Also, if it's a little cool, putting it in the microwave for 30 seconds to a minute probably sterilizes it very well and almost certainly kills the virus. So just making sure that you keep it warm will keep you from getting sick, most likely. You know, we all want to shake things up, and you know it's hard to eat frozen food and packaged food all the time. So going out to get food once in a while, again, depending on your level of risk tolerance is really what's important. If you're a very high risk person with lots of other medical problems and elderly and high risk, it may not be the best idea. If you're younger, don't have a lot of risks, and you're willing to take the chance, it's probably not that big of a chance, and you're smart about it. It's worthwhile, and like I said, you're helping out the community, which is important. So
I'm mindful of the time, and we have we won't cut off a hard stop at 8, but we're going to try to stop in about 3 minutes.
May I say one thing about the bleach on the lettuce?
Oh, please.
I'll say not a good idea.
Yes.
Leave it at that.
Yes. We can rinse our lettuce, but we don't want you eating Clorox.
No.
Please.
Yes. Thank you. Thank you for remembering that. So the 3 last questions, which we can very briefly answer. One is, what are your recommendations for non-COVID medical care? I'm going to just reiterate to all of you patients who are here right now that we are very anxious to see you on telemedicine visits. We really want to know you in your home. You can just sit like you're sitting right now, and we will have an official medical visit. Especially new patients who are new to Dr. Zweig or new to Dr. Havert, especially Dr. Zweig, haven't had the chance to meet him yet since he's only been here for 4 or 5 months. We would love it. He would love to meet you via video. So please come and discuss any of your medical needs via telemedicine visits, and then we will decide what's appropriate in your case. In general, we are deferring our preventive health right now because we're still in the thick of this virus, and we want to really make sure we help you keep it away. We want to help the momentum that we already have that's really doing well to flatten the curve and to let the curve drop. And so that's why we're trying to defer your preventive care just for a couple of months at this time. The other questions are about, there's a good question about how helpful is it to monitor your temperature? I'll give that to one of you. And then cleaning supplies, what do we do if we can't find any in the store? And then we'll wrap up. Dr. Havert maybe on monitoring temperature and Dr. Zweig on cleaning supplies.
What's tricky about monitoring your temperature, I mean, you could do it, but the real difficult thing about this virus is that you could be shedding it. You could have the virus for sometimes even up to 14 days before you have a symptom. So, and you won't have the temperature or anything like that. So, it's okay to monitor your temperature to see if, maybe you're starting to get sick, or, but you kind of just trust how your body's feeling, but don't use that as a reassurance of, I'm not sick, I don't have COVID, I am not going to spread this to anybody. My temperature's normal, I must not have COVID. It doesn't matter. You could be carrying it. You might never get a symptom at all. I mean, there are also people that carry it and you never get a symptom. But right now, the way that we have to look at this is everybody has to assume that they potentially could have it. I know that's sort of a scary thing to say, and I'm not saying it to make people scared. I'm saying it to just bring awareness to where we are in this, but also just to make sure that you are, we're coming together as a community and thinking about not only ourselves, but everyone else around us, because this is how we're going to get on the other side of this, is if we think about our community. Okay, this is a pandemic. It's a community problem. It's not, So I guess that's what I'll say about taking your temperature. If you want to take it, fine, but don't necessarily rely on it to say you're not sick.
Right. Yeah, it's something that they can do in hospitals to monitor people, but it's not sufficient. And then Dr. Zweig on cleaning supplies.
So again, this virus is kind of wimpy, and so just regular old soap and water works fine. Any kind of cleaner that you have, whatever you have around the house, as long as you have something, should be fine. You don't need a special disinfectant. You don't need Clorox, though that does work. And if you have it, that's absolutely fine. Really, any kind of cleaning supply will probably work just fine with this. So whatever you have around the house will work well. And then if I could just piggyback on Dr. Havert's community comment, that's one of the things, yeah, exactly, that's what's going to get through us, is being a community. And the thing that's going to make you feel better is however you can feel like you're a part of the community, either by doing this, or if there's something you can do, just such as donating blood, donating money to causes around the area. If you have, extra food or whatever, anything that you can do to help out. If you're able to go to the store and ask a neighbor who's not able to, if they need something, whatever we can do as a community to get through this and make things easier on each other will make it easier on everybody. And that's going to make this a lot easier and go a lot faster.
So it's important to think about things. It feels like there's a lot we can't control, and that's true. I mean, there are lots of things we can't control about this, lots of things we're still learning, but there are still lots of things we can control. And I think grounding ourselves in doing what we can do actually is very powerful. And it's like Dr. Zweig was saying, this is going to help push us to the other side. So just keep doing what you're doing. So grateful and proud of everybody for their sheltering at home. I mean, it's phenomenal. So thank you so much for everything you're doing for our community.
Well said. So with that, I think we'll wrap up. One question is NVFP still moving? Yes, despite the COVID crisis, we are still getting kicked out of our building, and we are moving in early May. We will let you know exactly the date when we know the date further, but it looks like we'll be able to be fully functional at our current office until we move. So we will be blasting you with information about that as soon as it's very clear. But yes, we are moving. We'll be in our new house for video visits in May. And very, very grateful to all of you for coming today. We will be repeating this next week. And please use this moment to send us a message about your responses to this, what worked for you, what you'd like to see next time. Dr. Havert is planning to host in 2 weeks a mental health town hall, a video town hall like this. So Dr. Havert, if you could let us know who's going to be participating with you in 2 weeks.
So in 2 weeks, I will be moderating a town hall, which will be discussing the mental health impact of the COVID crisis. There will be a psychotherapist as well as a psychiatrist, so two mental health experts. And similar to what we did here, we'll be asking for questions beforehand. So, you know, if you guys have questions, if that's something you're interested in, send those on.
Mm-hmm. Yeah, so please send in questions and comments. We're writing those down, and we really want to find ways to reach you. So let us know how we can help you, how we can help you stay safe, and how we can stay connected to each other during this extended social distancing. And thank you so much for joining us. We really appreciate seeing all of you. Good night.
Thanks, everybody.
Thank you, everybody. Thank you for joining.